Good Thursday afternoon, everybody. My name is Carl Hunnell. I'm the city editor at Richland Source. Happy to be joined today by Reed Richmond from Richland Public Health. There's a kind of a big announcement was made earlier today, and I thought it would be a good opportunity, and thankfully Reed had a few minutes to spend with us, just to sit down and talk about the news of the day and see if we can talk a little bit more about the whole coronavirus COVID-19 that's going on. So first of all, Reed, thanks for being with us today. This is a different way for us to do this. We're all hunkered down in our own bunkers, and I'm glad to see you're looking well.
So you said two old guys trying to figure out new technology, so we'll figure it out together.
Well, thank goodness we have some younger folks that know how to turn on a computer. Otherwise, when I started the newspaper business, my first front end system was an IBM Selectrix 2 typewriter. So technology
Yes.
has advanced just a little bit.
Where's the thumb drive going there?
What thumb drive? Okay. Well, first of all, again, thank you for taking time to be with us today here at Richland Source. I certainly appreciate it. So, what can you tell us about the news that came out earlier today?
What we announced was that we've been notified of a positive test result for coronavirus. That's the COVID-19, and it's for a resident of Richland County. Now, it's the first positive test result we've had for Richland County. So what that means is that we're working to identify any close contacts of this resident that would require testing and for symptoms of COVID-19 and possibly quarantine.
So, I mean, how long does that process take? Is that an ongoing thing? How exactly do you go about that process?
Yeah, the first thing that everybody needs to be aware of is that this is not a surprise to us. We knew this was coming down. I'm talking about Richland Public Health. We knew this was coming. It was eventually going to happen. It happened in Ashland. It was happening. And this is the thing we have to make pretty apparent for everybody. There are people walking around right now, and you have no idea. They're infectious. They have the coronavirus. They're just not showing symptoms yet. And so, when we start testing more people, the more people we test, the more these numbers are going to start going up. We're going to see more cases. This is not the first and last case that's going to happen in Richland County. You're going to see this in all 88 counties in Ohio. We've been preparing for this. Richland Public Health, our partnering agencies, the other local health departments, hospitals, physicians' offices have all been making preparations for this eventuality. So what this means about finding out about if you've got a positive test, you want to find out what kind of close contacts that person's had. If it's a person that's married, obviously there's a close contact right there. So that person would probably qualify for testing. If we find that there's close contacts, they're not showing any symptoms at all, we want to ask them to self-quarantine and self-monitor for 14 days. The purpose of that is that tends to be the run of coronavirus. One of the things that we've talked about in this thing is if you get sick with it, but you don't get severely sick, you just get like fever-like symptoms, flu-like symptoms. You get fever, you feel miserable. You may have a little bit of trouble breathing, but if you get over that, and 80% of us will get over that, in about 4 or 5 days, you'll feel like you're back to good health and everything, but you're still infectious for probably another week. So that's the importance of that 14-day quarantine.
Okay, now, and I understand there's a reluctance to talk a lot about the individual who tested positive here in Richland County. But is this a case where this is a person, maybe you can't answer this, maybe did they travel out of the area and come back, or is this a case of community spread, do you think?
Yeah, I cannot answer that question. I was not given any details about the individual at all, just that we had a positive test. I'm sure that down the line we'll get more information as more people test positive, and we're going to see that. The issue here about testing is it's been very slow coming down the pipeline. There are not a whole lot of testing kits out there. I don't know why Ohio seems to be the last one on the list to get testing kits. I know that they're getting testing kits at Ohio Health, Mansfield, and Avita, and they hope to be able to test people that qualify for the test. Right now, the only way to get tested is to go to your physician who finds out that you have all the symptoms. He counts out other things that it may be, says that, hey, this could be a case. Then he can do the test for you, and then you get sent to take the thing to a lab, or they send the thing to a lab. Right now, all the tests are going to ODH or the CDC, so there's a 3 to 4 day period there where we don't even know for sure whether you have it or not. So it's a little complicated right now. We hope down the future that the testing will be a little bit more obvious, a little easier to get. I don't think it's ever going to be a system where everybody can go get tested to make sure, because for one thing, you could test negative on this day and then pick it up the next day. So basically you have to be, there has to be something, some trigger that makes us say, okay, you need to be tested for this. And by the way, people that are talking about, just to add to that, Carol, that people are talking about, I'd like to be tested. This is a kind of an evasive test because they stick a swab up your nose, and they said people have had this done, says it feels like they're going in there and swabbing your brain. Yeah. So it's not like, just give me a simple, like I sneeze into a tissue or something. This is going to be a little painful.
Yeah, I saw one of the NBA players that tested positive. He said it literally brought tears to his eyes.
Yeah.
When they jammed that swab up his nose.
Yeah.
Well, one of the things I heard today, and tell me, and this was a doctor on a talk radio show, if someone's sick and they go to their doctor, the first thing they're probably going to do is perhaps test for the flu, the normal flu. And then if you don't have the flu, then maybe we'll test for something else. And kind of the COVID-19 kind of comes at the tail end. Let's rule out everything else first.
That's correct. They'll test you for things like pneumonia. First thing, of course, is flu. We're on the tail end of a really bad flu season, so there's still people that are calling in sick, not because I think I got the coronavirus, but because they're pretty sure they got the flu. And in most cases, the people had this sick feeling when people that we've seen stories about people who have tested positive, and almost every story is the same. They got headache, they weren't feeling well, they left work, or they stayed home, and then they just got worse. And most of what happened was they went to bed trying to sleep it off, and then they had trouble breathing. When you have trouble breathing, that's a really, really strong indicator that you need to go see somebody as soon as you can. Now, there's a couple of things about that. If you're going to go report to the hospital, you need to call them in advance and tell them that you're coming in. If you're in such a condition that you can't have somebody else transport you and you need to be transported, same thing applies. If you call 911, you need to tell them before they send an ambulance what you think your symptoms are, so that they can put on personal protective equipment.
Now, the vast majority of these cases that I've, when I look at the Centers for Disease Control map or the World Health Organization map, at least in the United States, the majority of these seem to be coming at least from just a few states. New York, California, Washington, they have far bigger numbers of confirmed cases of coronavirus than Ohio. Is there a good explanation for that? Now, Ohio is still relatively low, and would you attribute that to kind of the aggressive nature that Governor DeWines has kind of taken on this in the last week or so?
Yeah, I think that's part of it, is the fact that, the social distancing is so important. That's what we found out from places like China when they started to get a handle on the situation, and places like France and Germany and England is, start shutting things down to where you can create that social distancing. Italy was very late to the game. That's the reason why their cases continue to skyrocket. They had a very laissez-faire way of handling it. Everybody continued to do what they were doing, and that's why it spread so rapidly, and that's why they're having such a hard time getting a handle on it. They went from do whatever you want to quarantine overnight. So those type of things help. The other thing, if you look at the Ohio cases, it's a little surprising we don't have bigger numbers in Franklin County yet. But what we're seeing is like Cuyahoga County, because you have more people that, in a city area, more people that congregate, there's not that social space. So if you look at Richland County, we're very fortunate with the fact that we got a lot of agricultural area, people a little more spread out. Uh, there's not as much social interaction. I know it's painful to have to close restaurants and bars and those type of things, but generally speaking, we don't have the volume of people
Right.
that are in one area. So that's the other thing that's contributing to this lack of spread right currently in Richmond County.
Now, I watched at least part of Governor DeWines' press conference. He started a little bit later than he normally does, so I didn't get to see the entire thing. They did say there are 119 confirmed cases in Ohio spread across 24 counties. And I was about to mention to you that about half of those cases, 53 of the 119, came out of Cuyahoga County. So you kind of answered the question before I even had a chance to ask it. And that's the mark of somebody that's been doing this a while, Reed. So I congratulate you for that.
We have been doing this for a while, Carl.
Well, a couple of years anyway. Something I heard today, and President Trump mentioned it, and I heard a couple of other people on the radio. Have you heard about, and everybody wants to talk about the vaccine, which, we're months and perhaps more than months away from developing a vaccine. But he talked about today a drug to use as treatment. And he talked about, and it's hydroxychloroquine. It was something that used to be used to treat malaria, I think. There's some French doctor and scientist that's working on it. Have you guys heard anything about the potential, not only that one, but any kind of treatments for coronavirus itself?
Yeah, let's look at it this way. It's like flu. If you didn't get your flu shot and you got the flu, or if sometimes you get the flu, even if you got a flu shot, there's something called Tamiflu. Okay, so that's what you get prescribed. If you got the flu, too late to get your flu shot, you have a thing called Tamiflu. Well, this kind of right now there's no remedy or nothing to lessen the symptoms of coronavirus. So there are several companies. There's one in Japan. You mentioned one in France. There's also one in Japan that are testing out things to see if it will lessen the symptoms. The big thing that you want to lessen the symptoms is it's not so much the headache, the fever, the body fatigue. You just want to lessen that pulmonary congestion. That's the thing that keeps people from being able to breathe. So if you can knock down the virus, which is attacking your lungs, then you have a much better chance of survival. So that's what they're looking at as far as those type of things. As far as the vaccine goes, they initially said you're looking at 12 to 18 months before we have a vaccine. And today I read this story that they're actually doing clinical tests with humans in the state of Washington. And then you read the whole story and you go, wow, that's great. This is quicker than we ever thought we'd have it. And the last thing about it is, they're going to give them a shot. They're going to wait a week. They're going to give them another dose. And then 11 months later, they'll check and see how everybody did. I'm going, wow. Yeah. So yeah, you're looking at, you're thinking they're working on a vaccine. They're working on it faster than everybody thought anybody would do. But you're still looking at the clinical trials taking 11 months before we get around to manufacturing a vaccine. And then at that point, in order to gear it up and make sure that it's available, you're looking at another 3 to 6 months before that's out.
Well, I would imagine the pharmaceutical companies that are all racing to do this, they're going to get it out as fast as they can.
As fast as they can, yeah. There's, and hopefully the government continues to come through and say, if you have to get treatment for this, if you have to get a shot when the shot's available, they'll make those things free. I'm looking back at H1N1 when that's the last one that I remember where we lined people up and gave them shots. And the first people to get it were those people that qualify for it. And it'll be the same thing with this coronavirus vaccine when that becomes available a year and a half from now. But when that comes available, it'll be first group of people going through people that are 60 and over and those that have pre-existing health conditions.
That's something I was going to ask you about. What puts people into a higher risk? I've heard, if you're older, 60 and older, if you have pre-existing conditions like, is it diabetes and hypertension? Is it basically anything that impacts the body's ability to function efficiently? Does that put you in a higher risk
That's
category?
that's pretty much correct. And the basic thing is your body's doing so many other things to, to keep you surviving. So if you've got heart disease, if you've got diabetes, even being overweight is a symptom for this. I shouldn't say a symptom. It's a cause for this virus to take control. And of course anything that's a pulmonary problem. But it's interesting to me that when I was initially asked that question, I just thought it was probably pulmonary, like COPD, something like that. But actually, heart disease is the first thing on the list, and the second thing on the list is diabetes. And when you think that 32% of the people in Richland County have diabetes or pre-diabetes, that's a frightening number.
Yeah. Now, we all like to talk about the infection rate. I mean, we hear every day the numbers of people who are getting the disease. More than 10,000 across the United States as of today, according to the CDC website. But then I look at total deaths, and I'm seeing, and this is only in the confirmed cases, if you do the math from the CDC website this afternoon, and again, this is just United States, mortality rate of about 1.4%. Now, initially what we were hearing was, and this was outside of the U.S. as well, 3.4, 3.5. I mean, how does that mortality rate compare to some of the other pandemics, like you mentioned, H1N1?
Well, if you think about the pandemics we have, one of the absolute worst for infecting people and resulting in people dying is Ebola. That's one of the worst. It's like 1 in 3 of people that get Ebola are going to die. If you think about I'm going to tell you the horrifying number. They've projected as many as 2.2 million Americans will die within the next year. Now, that's a shockingly high number when you're talking in the millions. But if you look at it percentage-wise, that's only 0.007 of the population of the United States. So, and of the people that are getting sick with coronavirus, 80% of them are having what they term mild symptoms. Now, they may not be too mild for the person that's suffering from it, but they don't develop into the lung congestion where you can't take a breath. That's where people have to go on respirators and ventilators and that type of stuff. So there's a very small percentage of people that are actually dying from this. You're more likely to die if you have those symptoms, if you have those things that we listed earlier, if you're older or if you have a pre-existing condition. One of the good things that we've noticed on this whole thing, if you can term this as a good thing about this virus, it doesn't seem to be affecting children. And so children younger than 12. So that's a very positive thing. So it's more in the people that are, most of the cases we're seeing are at least 50 and over. And most of those people are going to recover. Initially in Wuhan, China, where it started, they had up to 7% of the population that were dying from that. And they've got that number down now, and the rest of China, and that number kept coming in. That's at 1.2%. And it's right now, it looks like that could even go lower, because the more people we term that are, test positive that recover, the lower that drives that number down. So comparison wise, it does compare kind of like the flu or like MERS or SARS in that area. So there's reason for concern, and I understand that this is on the TV 24/7, Carl, as you know,
Right.
And people can start getting a little panicky about it. We're particularly concerned about people that that have mental health issues, that have anxiety and stress issues anyway. This doesn't help them at all. So we're just trying to get good information out there, and then when I give you those percentages, it sounds like the Hunger Game. May the odds be forever in your favor, but they really are in your favor for most people.
Right. All right. Let's talk just go through some quicker questions. Does coronavirus, does it spread through the air yet, or is this something that you get from surface contact? Is it both?
Well, really interesting, because one of the things that we said early on is that it was not spread through the air, okay, unless you were within 3 feet of somebody who coughed, and then you've got that cloud that goes out there with the virus in it. So we were under the impression that it was not spread by the air. There's some conflicting reports now. Right now, what we're still saying is this is a surface contact thing. Either somebody's who's got it, shakes your hand and spreads it, or you sit down at a desk to use a desk, and the person that was just there pushed off the desk to get up, and now it's on that surface. That's why we're telling people to sanitize frequently used surfaces, because the information is that this can stay on a surface for up to 9 hours. Now, that's completely different than almost any other virus that we're looking at. Most viruses, they sit there on a table and eventually they die away. If you're outside, for example, most viruses don't last 15 minutes outside. They haven't tested all the areas where this virus might be, so I don't know, can't tell you for sure how long it's going to last on playground equipment, for example. Usually the sunshine takes care of killing a virus, but not enough testing has been done to verify that. I will tell you one good thing that we know, though, and speaking of ways to prevent the spread of this, you've heard of the N95 masks?
Yes.
That they have to use for medical personnel for protection. It's a mask that filters out 90% of the any type of virus, including the coronavirus. So we're trying to save those things for the people that need them the most. I know there's websites where you can order your own N95 mask. Really not necessary. It's just for, please, let's save that stuff for the health professionals. But one of the things they did, this gets back to the testing thing and how long something lasts. They went back and you know about the national supplies that they put away in storage areas, and they went back and they went and got all their N95 masks out. They had an expiration date of 10 years. Most of those had expired, but they CDC tested them, and 95% of them still were above their effective level. So that's great news that those things are still available.
So in this case, it's actually good that the government was hoarding. They weren't throwing anything away.
Imagine that. Yeah. Not so good for the public to be hoarding, but it's good for the government to do it in this case.
Oh. Now, is there any estimate? Everybody likes to talk, and the Governor DeWines has put the charts up a few times showing the Philadelphia curve versus the St. Louis curve back from 1918 when we had that pandemic. Is there any estimates yet of when we might see that curve, what that curve's going to do here in Ohio?
I don't think there's any estimates. I think everybody that I listen to, that I've seen talking about it, says we are going to have this rocketing up chart at first, and we're hoping, to flatten that. Carl, the interesting thing to me is there's a lot of states in the South. I've spent 21 years in Texas, and they're one of them, that are not doing the kind of things that we're doing in Ohio or Maryland or New Jersey or New York. And it will be interesting to see the comparison by states to see who flattens that curve, and to see what the difference is between people that are doing the kind of measures that we're doing in Ohio compared to what they're doing in some of the southern states. Well, it was interesting to me. There was a video yesterday where they're doing coronavirus testing in Alabama, and they're doing it right in your car, and the line's going 2 miles down the road. So there is some height and concern even in the South.
Well, I grew up in South Georgia, so I mean, I completely understand. But based upon the videos I saw on the beaches of spring break students down in Florida yesterday, they got a whole different issue going on in terms of social distancing.
There's not so much social distancing going on there. She's why am I not surprised?
Yeah, when I was 20 years old, if you'd have told me to socially distance, I don't know if I would have listened either. So, all right, we'll kind of wrap this up. Kind of one last question. I'm just trying to think down the road now in terms of, are there public health measures that this country can take now, or even in Richland County, that we can take now, so we're better prepared for the next one that's coming?
Yeah, absolutely. There are many things that need to be considered on the federal level, and one of those things is fully funding places like the Centers for Disease Control, to make sure that, for one thing, that you have people that are not just working on diseases in the United States, but they're also working in other countries. Now, that seems counterintuitive. Why aren't they working in the United States? Those people are feet on the ground and able to identify viruses when they start in other countries. And so you have a head start on those things. Um, it's easy to point the finger at China and said, this came from China. It's the fault of the Chinese, and this thing could probably have started anywhere. There's certain factors in China that caused it to start there, but it's the kind of thing where if we have people in Wuhan, China, when this thing starts, they've got an idea of, hey, we have to start preparing now. We literally started preparing for this virus way too late. We said we're going to do this and this, but we didn't do enough to stop this. And one of the things that we didn't do to stop this is we didn't have people already preparing this. We didn't start getting prepared for this until, mid-February. Whereas if we had people, boots on the ground, who could have told us this is going to get bad, this is going to get a worldwide thing, we could have been starting preparing in January, and maybe we wouldn't have had to take as many steps as we have now. So last thing I'm going to say, Carl, you know it's coming, right? Wash your hands frequently, soap and water for 20 seconds. If you don't have soap and water, use a hand sanitizer. Practice social distancing. Don't shake anybody's hands. I told Noah about namaste, so we can keep doing that, or do the.
Well, I was going to say, when we finish today, we're going to do the elbow bump like the candidates did.
So, cough into your sleeve, and for gosh sakes, quit panic buying. Right. One of the things that people bought was ibuprofen. And it turns out that ibuprofen is not a good thing to use if you have a chance of getting the coronavirus. They're saying acetaminophen. I probably shouldn't have said that because everybody's rushing out to get acetaminophen, right?
Well, if they rush out, tell them to bring their toilet paper back because the shelves are still empty.
Yeah. The one thing I can say about the coronavirus that we do know about the coronavirus is it does not cause diarrhea. So if you stocked up on toilet paper, you're going to have a great Halloween, I guess. But other than that, I don't understand the purpose for that. You plan for 2 weeks. If you have to be quarantined, plan for 2 weeks.
Right.
So, there you go. How many hand sanitizers did you use last year? 1, 2?
Yeah.
You don't need 40 now. Okay. So.
All right. Well, Reed Richmond from Richland Public Health, thank you very much for joining us here at Richland Source today. As always, a fountain of coronavirus information. It's always, go ahead.
Carl, I appreciate that, but I've got to give credit. I have to give credit to all those people that are behind me, the ones that are working behind the scenes at Richland Public Health, our public health nurses, our epidemiologist who's outstanding, our supervisor of nursing, our new health commissioner, Sarah Humphrey, all these people that have been planning and preparing for this whole thing, and making sure that we keep Richland County as safe as possible. I'm just the spokesperson for all that great information that I'm getting from them.
Well, I wish we had sat down today in a bar to talk a little March Madness, but I'm glad we got a chance to talk anyway. Thank you very much, my friend.
Thank you, Carl. Appreciate it, and good luck and stay safe at Richland Source.
Thank you, sir.